Assalamualaikum and good morning to Dr. Mota. My name is Nur Alia Patricia binti Ali Shamsur, and with my group mates, we are going to present the discussion video on issue number 3. Issue number 3 is about Malaysians that living with mental health issues. So for the starting, I'm going to define first what is a mental health. Mental health is related with an individual's psychology and emotional well-being. People with good mental health, they are able to normally do their daily routine, they are able to cope with stress or problems that they are facing, and they can also contribute to the society. However, we do know that mental health problem is one of the common problems or common disorder that happens to our society. It affects people by changing their moods, their behavior, and usually it is related with the stress or problems that the people are facing. If a person goes to a hospital or a clinic because they felt something wrong with themselves, because they want to check their mental health, the doctor will find it quite difficult on how to diagnose the mental health problems. Why do I say this? It's because mental health, it happens in very type of symptoms, but usually the doctor can possibly diagnose through these two things, which is physically or emotionally. As for an emotion symptoms, people with mental health problems, they will face trauma, stress, unexplained mood changes, and in some cases, they cannot differentiate between reality and hallucination. And as for physical symptoms, usually the doctor can check or observe that the patient or the victim, they will look fatigued, they will face loss of weight, and they will look miserable because they are not in a good health condition. I want to say that mental health problem is a serious problem, especially when the patient or the victim is helplessly getting any treatments, either from professionals or the closest people like family or friends. Because if they are not treated, they are tend to commit suicide because they are not able to cope with the stress or the problems that they are facing with. So that's all from me. I'm going to pass to the next person. She is going to explain the number of infected people in Malaysia and worldwide.
Mental illness includes suicidal thoughts, depression, bipolar disorder, and schizophrenia, and many more. And like many parts of the world, it is an emerging issue in the country and should be taken seriously. Let's get down to the numbers affected in Malaysia and worldwide. Based on data Befrienders KL Publicity Director Aida Ayadali said, 7,446 who called in 2016 had suicidal intentions compared to with 5,739 in 2015. Depression is a common mental illness affecting how a person handles their daily activities. This major disorder is affecting worldwide, with more than 300 million people affected, with an increase of more than 18% between 2016 and 2015. Anxiety is a condition characterized by persistent and excessive worry. According to epidemiological surveys, 1/3 of the population is affected by this during their lifetime, especially the young adults to those in their mid-30s. It is more common in women than men. Bipolar disorder is a manic depressive illness that causes unusual shifts in mood, energy, and activity levels. According to the National Institute of Mental Health, the prevalence rate of bipolar disorder is approximately 1.1% of the population over the age of 18, or at any time, as many as 51 million people worldwide suffer from bipolar disorder. Schizophrenia is a severe mental disorder characterized by profound disruption in thinking, affecting language, perception, and the sense of self. It often includes psychotic experiences such as hearing voices or delusions. This disorder affect more than 23 million people worldwide, but it is not common as other mental illness. It is more common among males than females. By 2020, mental illness is expected to be the second biggest health problem affecting Malaysians after heart diseases. According to the National Health Morbidity Survey in 2015, every 1 in 3 adults aged 16 and above in Malaysia suffer from some form of mental health issues. Today, A study revealed that mental health during the Movement Control Order (MCO) have shown that almost half of its respondents reported negative mental well-being with different levels of severity. From 1,084 respondents, 22% reported experiencing severe and extremely severe anxiety, with women and those below the age of 35 reported experiencing higher levels of negative emotions. Of those under 35, approximately a third reported experiencing severe and extremely severe depression and anxiety, from Center Statistics.
There are several lists of possible solutions to overcome mental illness problem in Malaysia. First, mental education, family support, expert guidance, which increase number of psychologists and psychiatrists, accessibility to treatments, provide programs for high-risk people, such as screening and intervention programs for pregnant mothers, COSPAN plus mental health training for employee, and also program Minda Sihat Sekolah for youth. And the sixth one is to provide school for mental illness patients so that they can focus on their skills and enhance them, and also reduce the risk for mental illness problems. And the next one is to spread awareness about these mental illness problems in our country, because to show that this illness is very important and very serious, but it is also treatable. The next one is to reduce the risk for mental illness problems in Malaysia, such as cyberbullying and also drug abuse. The next solution is increase or improve financial stability in our country, because some research shows that mental illness patients come from people who live in a low cost of living. So we will look one by one solutions to identify which one is more efficient, which one is more practical, which one is more low cost or high cost, and which one is more creative to overcome these mental illness problems in Malaysia. The first solution is mental education, which provide education on how to handle stress and anger management. It is quite practical, it is low cost, but it is not as efficient enough to overcome mental illness problem in Malaysia. The second one is family support. Family support is very practical, efficient, and low cost. The third one is the expert guidance, which increase number of psychologists and psychiatrists in Malaysia. It is practical and high efficiency, but it consumes high cost because the treatments is very expensive. The fifth one is to provide programs for high-risk people, such as screening and intervention programs, COSPAN plus mental health training, and program Minda Sihat Sekolah. It is also consume high cost because the programs need many facilities, and it is also time-consuming. And the next one is to provide school for mental illness patient. It is high efficiency, very practical, but it is also consume high cost. And next one is to spread awareness. Spread awareness is very practical and is very efficient, and it is also consume low cost. The next one is to reduce the risk of mental illness problems in Malaysia, such as cyberbullying and drug abuse. It is very efficient and low cost, but it is not impractical, because not everyone will stop cyberbullying or drug abuse. The last solution is to improve financial stability in our country. It is quite impractical because it needs many sites and many organizations to be cooperated so that these problems can be reduced in Malaysia. And it is also consume high cost, but if it can be applied in our country, it have high efficiency so that these mental illness problems can be reduced.
Assalamualaikum and hi, I'm Fatima Azhar alias with metric numbers 197375. Now without further ado, I'm going to talk about the best way to deal with mental health issue, which is family support. In this case, if someone you love or someone that close to you has severe mental illness or chronic mental disorder, name it, treatments, medication, or even community services can make things better. However, after all, we believe that family support is the key that play a big part in treating and recovering for those family members who suffer from different kinds of mental health problems, such as depressions, anxiety, chronic mental disorders, for instance, psychotic disorder, or famously known as schizophrenia, and many more. It is crucial for these people to get
the right help early so that things won't get worse. So what kinds of support that families can provide? First, talking to them will always be the first step that can be taken when you know your family members are going through some tough time. This way, you can figure out what is actually troubling their mind and in what way that is effective for you to help them. So listen carefully to what they tell you without making any judgment. And in this matter, you don't have to agree to what they are saying, but by showing you understand on how they feel, you are letting them know that that feeling is respected and thus somehow make them feel more appreciated and become more open to you. Also, don't pressure them to talk about anything that they are not ready yet. Let them share as much or as little as they want to. Second, offer them help in seeking professional support if you spot some worsening of behavioral changes in them. As someone who close to them, help them to find doctor or medical health experts and make an appointment for them. It might be quite difficult at the early stage to convince them to meet the doctors, but keep trying, but don't push them too hard. Also, tend not to take over on what to choose for them. Let them choose for their own self if there are preferences or options regarding the treatments. Other ways that family members can do to help is to increase level of physical as well as social activity for those family members who suffer from these mental health problems by bringing them out for hikings or to other events that give positive vibes to their mind and soul. Next, never ever ignore any societal comments or jokes from them, as this may be a warning sign for them not being able to cope with their own mental issues that they are having. In this case, you can alert their therapists so that bad things can be prevented, right? Overall, family members just need to give endless patience, support, understanding, and encouragement to them so that they feel they are loved and somebody is truly care for what is actually they are going through at the moment. By having engaged with therapists during treatment process, families can know and thus have better understanding on when and how to give support when signs and symptoms of worsening mental illness is detected. Okay, while you are too busy concentrating on supporting your loved one that suffer from mental illness, don't ever forget to take care of yourself too. This is because taking care of someone that is suffer from mental health problems can be quite stressful, time-consuming, and of course, drain your energy. So, if you are not well enough, guess it will be more difficult for you to help someone to gain their well-being if your well-being is itself not being taken care of. So admit your own limitation on what you can offer to them. When a loved one is diagnosed with mental illness, shame, social stigma, and fear will deter many family members from seeking any help. The important thing to do here is to stay connected with trusted family and friends to let them know what you are experiencing so that you are not alone, that you are all in that situation together. Last but not least, you can join a support group to share your own experiences in dealing with family members who suffer from these mental health problems. Learn from others on what to do, on what tips, right? And connect to someone who understands what currently you are facing at the moment. So to reach local support group, you can contact local community mental health organization like Mental Illness Awareness and Support Association, MIASA. Thus, once again, family support is indeed the best way in dealing mental health problems. That's all for my part. Thank you.